Is it recording or still capture? Okay. All right, hi there, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen, and the first thing that jumps out at us is that you have a lot of arthritis in the joint, which is what we expected. But we can see the humeral head is up above. You're laying on your side for the surgery, so your arm is up in the air, and up is the top of the screen. So that's the humeral head. The socket or the glenoid's down below. You can see how this cartilage is a little bit soft here. The inferior glenoid down below there still has some cartilage, but we can see up superior here that things are getting pretty thin. The good news is the shoulder can tolerate a lot more arthritis than a joint like the knee. We're just going to slip behind the biceps here because we can see this rotator cuff's got a little tear in it. At least a partial tear. Yeah, and that's what we're seeing there. I need a stitch for the biceps, please. Hi-fi. I need a number 1 PDS. And this is the biceps tendon that's partially torn, that's been causing some issues. You can see how red and inflamed it is at the base here. So we're definitely going to do a biceps tenodesis, which is one of the things we had planned to do today. Hold the camera. Yes, please. Okay, so we've released the biceps tendon. We put a stitch in it because we're going to be reattaching it in a little bit, but it's released from inside the joint. Here's the partial cuff tear. We're going to take a spinal needle, and we're going to put a kind of a marker stitch here. So you can kind of see where we're heading there. So I'll tell you what, I'm going to want a hi-fi suture here. So shuttle relay. Hold the camera right there. Yep. So we're going to pass a black wire called a shuttle relay. We'll show you how we do this. Now we're going to load that with a permanent suture. We'll pause on the video, show you some more in a little bit. Pause. Okay, so we've got our 2 sutures in the partial tear. Just to prevent that from propagating, that ought to be enough there. We're going to finish up inside the joint and have a look up above and see if we need to do anything more to the rotator cuff, and then also we have to secure the biceps. Okay, so we've the 2 sutures for the cuff repair. You can see them right there. And laterally, the cuff looks good. So as I rotate your shoulder here, there was no additional injury to the cuff, so that was good. And then anteriorly, we tied the suture for the biceps tenodesis right there. So there's 1 suture, 2, 3. 1, 2, 3. And they're all lined up there. And as we rotate the shoulder, that's moving as a unit. So I think that's good. We're going to take off a little bit of this anterior bone spur just to make a little more room for the cuff, and then we'll be done. So this will be the end of the video, okay? Good luck to you now. Bye-bye.